Hi, everybody. It's Susan Clinton, and I'm here with Erica Mello, and we are going to talk about a couple of gracious people who have left us a testimonial on iTunes, or a review on iTunes, I guess I should say,
Yeah,
and pick another winner for our webinar. And Erica?
sounds good. And once again, thank you all for giving us these great reviews. We really appreciate it. I'll be brief. The most recent one was from New WWF, a great clinical translation podcast. This is my favorite while on a trail run podcast. I can get into the content of the focus for the episode and quickly find myself thinking about my patient and clinical tools, considerations, or views to take back into the clinic. Thank you, Erica and Susan. That is New WWF. Thank you so much for that wonderful review. And this second one is Love the Critical Thinking by KIO.master. Eric and Susan show great critical thinking during these podcasts. I love hearing how their minds work. They give me lots to think about. And thank you so much for those wonderful reviews. And we have picked a winner, of all, for all of the reviews that people have left us for, gosh, now how many years now? 2-3 years. So the winner is here. Victoria S.A. is her iTunes handle. Victoria S.A. Awesome podcast. This is a great podcast. I love listening to the clinical reasoning for patients who present with interesting, challenging symptoms and how these two women walk you through their process. It has helped me greatly in my own practice to look at the global movement of my patients and not just their goniometry measurements. Such great content. Thank you, Victoria S.A. Please email myself at erica@ericamello.com or Susan at embodia-pt.com to claim your prize on our webinar. Thank you again, everybody. Really appreciate it.
Right. Thank you so much. Enjoy the podcast. Hi, everyone. This is Susan Clinton, and welcome to the podcast this time. This one is about a patient of mine that we all run into because we have patients who never remember to tell us certain things until all of a sudden we're ready to start a new evaluation technique, and then they go, oh, by the way, I forgot to mention to you that I had surgery, or I had this happen, or I had that happen. Have a listen to this case and let us know what you think. As always, we look forward to your comments, to your reviews, and thanks for listening. Hello, everybody. Welcome to Tough to Treat. I'm Susan Clinton, one of the co-hosts of this 75th podcast, here with my co-host, Erica Mello. Hi, Erica.
Hi, Susan. How are you? Yes, 75.
Yep, we've made what is this, the Silver Jubilee, I think they call it. So anyway, I never thought we were going to get past 10, so this is quite a landmark for us, I think, and it's very exciting.
Yes.
And it was great because just before we signed on for this podcast, we announced the winner of our very first webinar giveaway. So
yes.
If you missed that, scroll back and listen.
Yes, you have to listen in order to know if you won.
That's right. And we're still asking people to, like we said in the intro, we're still asking people to, jump on, give us that great testimonial, and then we will put your name in the contest for the drawing. And also a big shout out and thanks to everybody for joining us on the Facebook page for our Facebook Lives, as well as some great questions and answers going on. So lots of fun.
And I think the reason why testimonials are so important is that with Apple and iTunes, at least as far as I know, with the Apple users, it's the only way people can find us. We've changed their algorithms, and testimonials really help people find us. So we would really appreciate it if you could do that. Yeah.
All right. So you ready to dive in?
I am ready.
Okay, so this is kind of an interesting case, and I was thinking about this the other night because you and I are taking the Reframe Biopsychosocial class together with Carolyn Van Dicken,
Yep.
and talking about some questionnaires and questions and things like that. And and oftentimes we don't find out things about our clients until we actually gain their trust enough and we get into it with them. And so some of the things that all of us might think are very obvious to us that people would talk about, maybe a carefully guarded secret to somebody else, or something that they actually have completely walled away and not even don't even think about it. So either they don't want to talk about it, or they've just completely put it somewhere on a shelf in the very back corner of their brain. So I'm going to tell the story here of a 39-year-old female who had been complaining of shoulder and neck pain for some time. She was a friend of a friend who finally convinced her to give me a call and said, you should really check out Susan and go see her. You've been putting up with this for a long time. And, all I hear is you complaining about it all the time, so you should give her a call. So she did. And we talked on the phone, and she was just telling me the very typical things that you would think about shoulder and neck pain. She works on a computer. When she's working for long periods of time, of course, things hurt worse. It's her neck and shoulder pain are on the side with the mouse, which is the right side for her. You can just kind of see the story kind of going on, almost like where you're kind of tapping your fingers going, okay, this seems pretty straightforward, right? As PTs, we kind of project ahead with that pattern recognition. And we start, so, she's telling her story, and, sometimes it wakes me up in the middle of the night if I have been sleeping wrong, on one side more than something. Sometimes there's pain that goes down the arm, mostly centered in the shoulder and under the shoulder blade.
Okay.
Some tightness she feels like when she's trying to move her arm around compared to the left arm, but it doesn't really stop her from doing anything. In other words, she could still go to the gym and push some weights around. She noticed it more if she was like doing some really like fast walking.
Mm-hmm.
And I said, well,
fast
describe
walking.
your fast walking. Yeah. And she said, it's, and so she showed me, and everybody of course can't see me, but if you think about somebody who's really like using their arms, like a power walk. Exactly. Fast walking is what she called it. When I get into fast walking, it can bother me. And I thought, okay, let's file that away, because I had a couple of questions about that. And when she would get on her hands and knees, it would bother her. She would notice it more. So it was always kind of there a lot, but it would increase if she was on the computer for long periods of time, or she like in the middle of working and she would finish and kind of try to straighten up, and it would be bothersome for sure. And also just sitting in a chair and reading.
So many different
bothered her, and I'd say, so what would happen with that? Well, the neck pain would increase, and sometimes she said it would kind of creep up around my ear.
Okay.
So again, not an atypical story of somebody you're just kind of thinking, gosh, what's going on there? Is this a musculoskeletal deal? What's really happening? It's starting to sound pretty musculoskeletal. Until she told me about the fast walking.
I know, because all these different movement patterns, right? Or all these different, right?
Exactly. So, and hands and knees kind of made some sense, so you kind of start thinking, gosh, is this a strength issue, around the scapula? What's going on here, and why did that happen?
Right. Yeah, it is interesting.
Yeah, so fast walking kind of tripped me up, like you were talking about movement patterns. And, but the thing that kind of got my attention with the fast walking was I was starting to think, well, does this have like a cardiovascular piece to it? Women are always a little atypical. It is the right side and not the left side.
But I was just kind of thinking, why would that bother her with fast walking other than the movement that you were talking about?
Fast, exactly.
Right. So I just had to throw that out there to everybody as a differential to just kind of think about is respiratory, because we're thinking about trunk, and I know Erica's going to go right to the thorax.
Yes.
But just thinking, okay, so that's going to require the thorax, the shoulder, the scapula, things to move a little bit differently. Maybe the head.
Yeah.
So there is that. But I was also thinking about, I wonder if it's a heart rate issue too, something like what else might be kind of like underneath here driving this just a little bit.
Yes.
So I just put that out there. She doesn't fit the time frame that you would think across the lifespan for like a huge cardiovascular red flag or a respiratory red flag, but it did beg to ask a few questions around there. If she, I would certainly be, my radar would have been way more up if she was 59 instead of 39.
Yes, of course. Yeah.
Like that kind of thinking about some other things. So as usual, I always take vitals when people come in. I always do a quick blood pressure, especially if I don't know, new patients, always get a blood pressure, always get a heart rate. And, just because I can. And, all of those were fine. There wasn't any, kind of like high blood pressure or anything that I could detect. She wasn't on any kind of medication. Has been checked regularly by her doctor, never an issue. She said that, she goes, I'm not sure, but, she said, I have been, kind of sick off and on. And I don't know if that had anything to do with this. And I said, well, what kind of sickness? She goes, well, a lot of respiratory infections. And I said, okay, anything recently? Well, no, not for a while. Like, all right. So, just kind of covering the bases, asking a few things, trying to get kind of a handle and a feel on, is this person healthy? What's really going on? Is there anything underlying? Have you ever had like you talk about, have you ever had any kind of thing with your heart, like heart racing, heart palpitations, anything that you're discussing with your doctor about around your, cardiovascular system? Do you ever get in a hurry with any other exercise? That's one of the things, other than fast walking, like what else do you do at the gym? Do you get on the elliptical? Do you,
right.
Do you do the row machine? Well, those kinds of things. She said she doesn't do the row machine because it's boring. She doesn't really do the elliptical, but if she does, it doesn't really seem to be much of an issue.
With the arms and everything. Interesting.
Right, yeah, yeah. So, well, she said, I did ask her, and she said that she holds onto the rails and goes.
Okay.
So that, so that kind of tells you, So it's like, well, it doesn't really, but she doesn't do it very often at all. So hard to really kind of correlate the two together. So, just something to kind of put on to the side and think about here. Just like I always like when those little things come up to just kind of like, let me just dive in and ask some curious questions about that. What's going
Absolutely.
on. Yeah. And of course, we talked a little bit about what do you think is going on, me with my questions. And, she said, I think that there's just something that she goes, I don't know, maybe I have a disc in my neck and this is what's causing this problem and it just hasn't gone away. So it must be a pretty, I guess once you get a disc, you always have a disc and then you have to be super careful. And, but I don't know. I just never thought about going to the doctor about it because it just seems so frivolous. And I'm like, frivolous? Why does that seem frivolous? Well, because it's not a life-threatening kind of thing. It's just, I have pain.
Thank God.
So, I have pain. So it's like, so you don't think getting your pain taken care of is like worthy? And she goes,
exactly.
It's just not as important as other things. And it was like, okay. So what do you think is going to happen if we don't take care of this? Well, it'll probably, I don't know. It may stay the same. I'll probably just have this pain forever. You're very nonchalant about it in many ways. Yeah. And I said, and so finally I just said, so why are you here? What do you want to get at? That's that, what are your expectations here? And she goes, well, I just am curious because if there's a possibility that this can get better, then that would be a good thing. I said, okay, so it is worth it to you to make a change here.
Yeah.
Goes, oh, yeah, it definitely is. She goes, I just never thought about it because it just didn't seem to be anything. Go to the doctor when it's life-threatening.
Interesting.
And it's like, okay, but you see your doctor pretty much often. Oh, yeah, definitely see my doctor every year. And I said, okay, anything else going on with you that I need to know about?
Yeah.
Any other surgeries, any other history, anything else? And she said, nope, everything's good. And I said, okay. And then I asked her, the other, me with like, what are you afraid of? Like, what in your heart of
Oh
hearts
gosh.
is really worrying you? And she goes,
Yeah.
that's an interesting question. Maybe I'm afraid that there is something seriously wrong underlying here with this,
Oh.
and I don't know what it is. And I said, okay, have you discussed this with your doctor? No,
No.
because I really think it's this. And it's like, you know what? Let's space hold that then, because that's
Yeah.
a really important thing
Yeah, for
that you
sure.
just said. So,
Yeah.
and just kind of remember that as we go along. Do you have any other questions before I?
No, it's just no. It's just the different movements bothered her. She had some respiratory infections. Goes once a year to the doctor routine, and based on what you just told me, she's afraid. If she goes to the doctor, it will go from like a once. The threat level will be just, or like it'll be a life threatening. Like that's why she goes to the doctor, and she doesn't. She's afraid. That's what I'm getting out of it. So.
Right. Yeah. And so when I was asking her about what scared her about it, if anything scared her about it, what she was worried about, she actually had this flushing in her neck. She's a white woman. That's not an unusual thing, but it was kind of interesting because that was the only time it came on. Sometimes, people who tend to be, have that flushing kind of stuff really close to their skin, it tends to happen the minute they walk in and meet somebody new, a little bit, but it happened at that moment with her. So I just kind of set that to the side to just kind of work on as we kind of move through, as something important to think about. Yeah.
I did have one question. Does she have a family? If you said it, I missed it. Does she have children, or is she on her own?
Oh, yeah, she's married. And she had one child who was 17.
Okay. Got it.
Yes.
Got it.
So, yeah.
So she got married young. Whoa. 22.
Yeah, she married young, has this 17-year-old boy, and but no issues, and has always worked. Things have been fine. None of those kinds of things.
And she power walks by herself or with a group?
By herself.
By herself.
Yeah,
what does
she's
she do?
One of these that drops on the earphones and goes for a walk. Yeah.
Yeah. Okay.
Yeah, she works in an office in a kind of a, I don't know how, not really a bank, but kind of something like that, something in finance. So she was on the computer a lot, little bitty numbers.
Got it.
Peering into the screen, things like that. We've kind of talked about that a few times too.
Yeah.
So anyway, she had on like a long sleeve shirt. It was winter time, and it was, chilly outside, and, I just said, let's just get moving, so did some looking at her, had her do just some regular movement patterns. Like, can you, tell me what happens when you bend over and, reach for the floor, looking for flexion in her arm in a little different way, kind of, fool the system a little bit and see what I see there. What happens when we twist, just kind of getting into the trunk a little bit there in the thorax. What happens, watching to see if she's turning her head, as she was twisting and turning. I'm just seeing that willingness to move.
Yeah.
Kind of things. And I said, what about if you reach your arms up in the air? What happens there? What if you reach your arms behind your head? Just looking to just see that active motion.
Yes.
She didn't turn her head to the right a lot, as much as she did to the left. She was very willing to turn her head to the left. To the right, she would turn it, but it was just like not going all the way. So it's kind of like, okay. She could have turned her eyes a little bit better when I cued her to turn her eyes with her head. That did help a little bit, but not a lot. It was definitely interesting as she leaned over her right shoulder. You could just see the whole scapula riding up. Well, right, I guess as her trunk was inverting, it'd be riding down on the trunk, but on the thorax, but basically riding way up, like up and around as she bent over. And the other side, not so much.
Oh, interesting.
When she raised her arms up, you could definitely see the entire scapula coming up into the, coming up and around, and just really this large amount of scapular range of motion on that right side compared to the left. I mean, just like it was so obvious.
Yeah.
and even kind of winging the the
Yes.
vertebral border, kind of flipping up a little bit.
Right. So some like
Mhm.
over elevating, over abducting, a little
Yeah, just the
tilting.
whole
Got
thing,
it.
just like the whole mass pattern of movement
Yep. Got it.
going up. And then in the front, you would see just an exaggerated movement of the clavicle coming up as well,
And this
right
is just
greater than
also,
left.
and this is
Yeah.
just squatting with reaching, just moving any arm movement,
Anyway,
any functional.
all movements, they all produce the same type of hyperscapular mobility. And that, just it was like the whole scapula, the whole shoulder girdle just did this whole thing. It just like it just raised up and rotated forward with any kind of arm movement.
Got it.
She could get her hand behind her head. She could get her hand up in the air. She could do all the things she needed to do, but it was because the scapula was doing all of this.
Yes.
She was gaining this momentum, this motion through her scapula and not really through her glenohumeral joint as I was looking at to see. And so I said, okay. So basically what we did was I just had her lay down on her back and I just put my hand underneath her scapula. I said, raise your arm up. And again, you can only imagine the scapula moved early and fast. And so I just kind of, blocked it a little bit and said, we're going to keep this here and not let it move so much. And she could get to about 90 to 100 degrees, maybe, if I didn't allow that scapula to move. Okay. On the left side, she could get to about 130 before her scapula really needed to move.
Got it.
So that was a pretty significant difference.
Yeah.
As I had my hand on her scapula, I could just feel this drag, and I was like, "What's going on here?" So
you mean like a glitchity glitch?
It was like it just was like sandpaper or something there, kind of like what's going on here?
Scapula. Yeah,
almost like. And so finally, I just looked at her, and as she was laying there, and she looked over at me, she said, "What?" And I said, "Do you mind if you take your shirt off? Because I just want to see what's happening to the whole shoulder as we move." I had my suspicions. As she took her shirt off, plus I wanted to see her take her shirt off. I wanted to see what she was going to do. And she actually grabbed hold of her sleeve and pulled her arm through on the right side. She grabbed her sleeve and brought her elbow into her body and pulled her shirt off that way.
Interesting.
And then she sat there, and I looked at her and I said, "So, when was your breast cancer?" She had the most amazing fibroid scars across the front of her chest that I have seen in a very long time.
And wait a minute, did she tell you she had breast cancer?
No.
What?
And remember, I asked her all of those things. I asked her, like, any surgeries. She sees her doctor on a regular basis. She's had respiratory infections. She had, right? So I was just like, and she just looked down and she looked at me and she goes, "I forgot to tell you I had breast cancer."
Of course, yeah, exactly.
And part of me, of course, wanted to be super snarky and go, "You think?" But it was just like,
blocked it out or whatever.
Yeah, I just said, "Well, do you want to talk about it? Would you like to tell me about it? At least can you give me some?" She goes, "I just never think about it."
Wow.
And I said, "Okay." And I said, "How long ago?"
Yeah.
Well, it was over 10 years ago. And, it was just like a near life and death experience because, being in your reproductive years with breast cancer.
She was
like
29.
29,
wow.
Yeah. Wow. And she survived it, and she had passed her 10 years. She said, "I passed my 10 year last year." And she goes, "I made it a pact with myself to never talk about it." And so I said, "Okay, but this may have a lot to do with how your shoulder is moving and your neck pain." And she just looked at me and she goes, "I just never thought about that."
Well, of course not.
This
she
is
blocked it out of her head.
We're looking at a serious case of disassociation here.
I mean, oh my God! Like, what did she have? Did she have a mastectomy or anything? Right? Did she just have a lumpectomy? She had on a bra that had a the
breast prosthesis in it.
Got it.
So if you looked at her, with clothes on, you wouldn't have known. Those things are so good now. It's really hard to tell until she
Wow.
took her shirt off, and you could just see the, web of scar tissue and the
Yeah.
radiation
Yeah.
scarring
Oh my
all
God.
across her, the front of her chest, and it went into her axilla, of course. And that's
Yes.
what I was feeling in the scapula, was that dragging, because that scar tissue is just so tight and so tough.
No wonder her scapula was moving. She couldn't move her.
Yeah,
Her
so her
humeral
scapular
joint.
has to do all of this moving, and it
Wow.
pulls her shoulder into internal rotation every time she moves, which was that kind of funky thing I was seeing with her arm movement, because of course the axilla was kind of bound down a little bit as well.
Wow.
And so we taught, so as it kind of came out, I said, let's just do some easy work on your shoulder here, and let's see what we can kind of get going. Let me get into your neck a little bit. I just felt like she, we'll just talk a little bit.
Yeah.
I just wanted to kind of feel like, does she have good joint motion? What was going on? Let me just, no pain, no tenderness to anything I touched, at all. She did have some moments when I would side bend and rotate her cervical spine to the same side, that she could feel some stuff, behind her shoulder blade, underneath the shoulder blade, which isn't atypical of, a little facet irritation or something.
Yeah.
But, so I just kind of postulated that the facets got a bit irritated in the neck area because they're being pulled into compression every time she moves. Because if her scapula is rising up and coming forward, it's bringing the facets of the cervical spine into some compression.
Exactly. You're bringing the two ends together.
Mm-hmm. Yeah, exactly. So that was, so we talked, and I said, it seems like your neck, because of the way that your arm has to move because of the scar tissue, it seems like that may be one of the reasons that your neck is getting a little bit irritated. So let's just kind of see what we can do to change this up and change a few things around to make you a little bit more comfortable in some of the things you talked about.
Yeah.
So we just basically assimilated her desk, and we went through some things, and I come to find out she has her mouse way up. A lot of people do this still. Her mouse is way far away so that they're in this full extended position with their hand, way over here. And she also has a screen to the right. Another screen to the left, so she never turns her head right.
No.
So she's got a screen in front of her and one to the left, so she's constantly looking over here with her arm going over this way.
Yeah.
And then when it comes time to turn, so she's being set up motorically, to just be over on the left side
that one
all
side.
All the time, right? So we just basically just went through a little bit of that, gave her some stuff to do, talked a little bit about, let's start interrupting your productivity time so that you can get up and move a little bit and change. Talked a little bit about you're kind of just ignoring your body signals, because you get so busy into what you're doing with work. I wonder what would happen if you actually moved every hour, and she said she would be willing to do that. Let's give that a try and see if it begins to settle some of the symptoms down at work. We talked about repositioning books with pillows.
Yeah.
Like she said, this seems so easy. I'm just wondering why I never did it. And it's like, well, sometimes we just need to talk about it with somebody, and then it becomes, we can take, it does seem easy, and that's probably why you never tried it, because it just seemed too easy to make a difference. I don't know.
And it wasn't a priority for her. Maybe. Who knows?
No, she was just like, it wasn't life-threatening.
Exactly. Breast cancer to her is life-threatening, obviously. And, it's interesting. I've had a patient too a while ago. She had cervical and breast cancer, and she came in to see for I don't know, this was after an accident. She was the same thing. She's like, I thought that maybe this would go away. Maybe not. It's no big deal. It's not a priority when you've been through something like that, right? So interesting. It really is.
It's hugely interesting. But what was very interesting was what I felt like, now I'm not going to diagnose, but I felt like that her, just the complete flat base, I don't ever think about it anymore, kind of seemed a little bit off to me.
It's like neglect, right?
Exactly.
After a stroke or something, right?
Exactly. She has just decided to, I started immediately thinking of David Butler and how he talks about falling back in love with your body part. But, she did it when she filled out the central sensitization inventory, nothing.
Yep.
When she filled out the neck disability index, it was a little bit high, mainly because it targets things like amount of hours you can work without pain, reading, sleeping, which were some of the big things.
Yeah.
So of all that, so it just kept looking really super biomechanical to me when you looked at all, like she didn't have the depression anxiety scale, nothing.
Nothing.
The Tampa kinesiophobia scale, nothing, because she just figured out a way to move.
Right. Exactly.
And do all of that. So I know a lot of people are probably sitting there thinking, well, if it's, just why are you even talking about it? Well, because it just seemed off. She just was just so but as we kind of started working, that's why I just went after the things that she cared about. Like, we're going to talk about workstation. We're going to talk about some reading. I said, the next time we come in, we'll look at maybe some fast walking and see some stuff that's going on. But I told her, I said, I'm just wondering if some of the symptoms you're having with the fast walking is the fact that the scar tissue here may not be allowing your chest wall to move as well for the respiration that you need.
Right.
So it could be either trying to move this way or trying to move up here. Could be both things that may be triggering some of your pain response.
Yeah, because she's moving her arms, depending on how power, quote unquote, she's moving.
Right.
That scapula is going, and it's the path of least resistance. She's had respiratory infections. It's almost like, when you're like an athlete trains, and certainly athletes are biased to one side, but you want to give I think I mentioned this before, you want to give your body options for movement, and she doesn't have a lot of options because she's lost that right side, that it's almost like that David Butler, that left right discrimination. Does she recognize her right side? You need to train that side, even if you are using more of your left, because you need to give your body choices.
Right. And I thought that was interesting, because remember, getting on her hands and knees bothered her.
Yes.
When she had to involve her right side.
Yeah. Yes.
Into weight bearing and some different things. So when rotation comes in, and you have to get rotation to the other side with fast walking.
Yes.
Because you can't fast walk to the left.
No.
You gotta, so it was, it's just, and I'm just, so part of me is kind of like, well, can we break this down and not play pop psychologist? And I'm not going to influence her with my clinical narrative, because I can tell you what my clinical narrative was that she was, like you said, like it was almost like right side neglect.
Yeah.
And that if she was forced to be into that position or anything over there, it triggered a pain response. Okay, that's me playing pop psychologist. So I thought, I'm not going to lay that on her, because this may not be her story at all.
Yeah.
It may not be. So I just kind of asked her, I said, now that we've done some of this stuff, what are your thoughts? What are you thinking now? And she goes, well, I have to tell you, she goes, I'm beginning to think that maybe my story with my breast cancer may have a lot more to do with this pain than I really thought it did. That came from her. I did not put that on her. I never once said any of that stuff I just told you. Those were my suspicions in my head. But I just, again, I wasn't going to give her a badge of dysfunction to wear around with her. All I did was talk about scar tissue and, the challenges that she had with, moving around the scar tissue.
Yeah.
And she told me her story around her pain. So I just kind of went with that. And I said, so how do you feel about going back to your office and making a few changes like we talked about, and maybe just changing the way you're reading your book and just see how it goes for a bit? She goes, so she said, I think that would be great. I'd like to do that. But she goes, I'm really thinking maybe I need to talk more about my breast cancer too. And I said, okay, what does that mean when you say that? And she said, basically, I think what it means is that I have just been pretending that I haven't had it. And she goes, obviously, there's reasons why I need to talk about it. And she goes, and now that I'm starting to talk about it, I really think that I need to talk more about it.
Oh.
And basically, kind of in that roundabout way, of course, with a Kleenex and lots of tears.
Yes, of course. I can imagine.
So basically what I did with her is we sat down and I said, how do you want to be supported for this? And she said, well, I don't really know. And I said, have you ever talked to a counselor? Have you ever talked to a social worker, a caseworker, anybody, somebody from, kind of a support type system? psychologists, anybody about, this stuff. And she said, the doctors told me when I was going through this that I probably should, and I told them that I didn't need it, that I could get this on my own. But she said that she's been also, now here comes the stories.
Okay.
It's not just the neck pain that wakes me up, it's night terrors.
Oh, wow.
That she exercises because she firmly, and she wants to do this fast walking and this exercise because she's afraid that if she doesn't, her cancer is going to come back.
Wow.
She drives everybody crazy around her with like all of these different things that she does with eating because she wants to like be super healthy.
Oh, boy.
She,
Wow.
just all of this stuff is starting to kind of tumble
There's
out. So
fear.
we just
Yeah.
sat for a while, and she kind of told me, all of this stuff, and we just kind of sat there together with it for a bit. And I said, would you like some referrals to some people? And she said, yes, because I don't even know where to start. And I said, well, I think there's 2 people that I have in mind that I think would be a good fit for you, and I know would talk to you ahead of time to make sure that, you feel comfortable with them. So I gave her the names, and one of them was a trauma specialist, because it seemed like to me that she was, this was that not only was she coping with, or trying to cope with something that was like, very life threatening, but that she was traumatized by it.
Yeah, for sure.
And this
Completely.
whole disassociation thing kind of, just that whole flat face, I don't want to talk, kind of thing, like not even mentioning it,
Wow.
you know,
Wow. The
and then, then of course she felt bad that she never told me about it, and was like, don't feel bad. This is
no,
fine. It's
right.
when you're ready, you're ready, and it's okay. We'll solve whatever problems we can, but, I think that the support you need right now is for this too. So bottom line, her pain actually drastically in the next 2 weeks really went down.
Yeah, of course.
And we made some changes at work. She started feeling that maybe she needed to start with her trauma specialist was working on beginning to accept her body again and loving her body for what it was. And so she started coming, she was continued to come to me to help her make physical changes and to give her hints and techniques and exercise to challenge her to use that right side and bring it into her body a
Mm-hmm.
lot more.
Yes.
So she actually agreed to switch her screen over to the right side.
Mm-hmm.
Took us time to get it over there, and I said, you may have to
Yes.
turn your chair for a bit until it feels comfortable. But
Mm-hmm.
she was good with that. She started, we kind of took a look at her walking, and we slowed it down a little bit and got her into some more rotational exercises and things like that. On the I said, on the elliptical, just, instead of trying to do 45 minutes of hard work, why don't you break it up and let's see if we can do some gentle work and then some faster and gentle and faster. Give your rib cage and, a chance to do. And then we did all of those things that you and I have talked about in podcasts before.
Yeah.
Getting the rib cage moving, getting her, to practice with her arms on the wall, arms, and, on angle push-ups and,
Yep.
strategies, and, just working to get, to bring some strength and coordination back around her scapula a little bit.
Yes.
And,
Yes.
you're not going to change scar tissue in 10 years. You're just not.
No.
Everybody's, you should release her scar tissue and do all this stuff. It's like, that scar tissue was there to say. What we worked on doing, and we talked a lot about this, as I said, we're not going to change the scar tissue, but what we maybe need to do is get your brain to stop protecting it so much. Now she'd been
Mm-hmm.
weeks into some counseling too, so she was ready to kind of buy
Yeah.
into all of that stuff, and do that. And so once she kind of, so we the scar was there, but we actually got her chest wall moving better. So the scar, the scar tissue in the front would actually move with her chest wall when she started to move, instead of holding
Yeah.
her back and making the scapula do all the movement around it.
Exactly. Yeah.
Was it ever going to be perfect? No. But was it a lot better? Yes. Did she have pain? It went away.
Yeah.
But she needed to slay a couple of demons to help
Totally.
that, and do that. Um, to this day, she's probably one of my biggest referral sources. And
Wow.
she never sends anybody that's had breast cancer. She sends her friends that have had, their leg is hurting, they need to go see Susan. Their foot is hurting, I don't know what's wrong with them, but you need to go see her and let her talk to you.
Oh, that's so
She's
funny.
she's great. But she's moved along, and she still is in remission, which is amazing and awesome and wonderful.
Yeah.
And she just
Yes.
had a really good successful outcome. But now she's thriving now, rather than continuing to just survive. And I think that a lot of
Yes.
times we forget that people and the stories and the journeys they've been through sometimes can hang with them so much. And this is not this one was a big one, and I wanted to bring it up on the podcast for a reason, because I think it was your podcast, I can't remember how many ago, but you were talking with somebody who said, and oh, by the way, and it's like,
Oh,
why do
yes.
people do that? Why do they forget
Right.
these things?
Mm-hmm.
And it's just that once we kind of, once we realize that we're not going to, I think playing pop psychologist, once we realize that we're going to survive it, or it didn't seem like it was a big deal, then we don't think about them. So we don't remember that we fell off a bike and, caused all that stuff, like that young man with his thoracic fracture,
Right.
the stress fracture.
Exactly.
He doesn't remember, he can't tie the events together, because just like that was like that, I'm fine from that,
Yeah.
But like you say, the system can move until it can't. And, we run out of options. And I think for her, she could get by, she could do it, but what was happening was she was running out of options.
Yes. Yes.
And it just seemed to me that it was signaling some sort of threat response to her, because we didn't do that much to unweight and unpack a compressed facet joint.
No.
I didn't do that much to, we just did new and novel inputs to things.
Exactly.
In a way that was safe and centered around the stuff she was complaining about.
Yeah.
And allowed the other stuff to come up as it was going to. And then she did the heavy thinking work.
Mm-hmm. It's interesting.
And surviving and survival remorse and whatever other work she needed to do with her trauma counselor.
Yeah.
But she was a lot more generous with the right side of her body.
Mm-hmm.
You could just see it happening as she was kind of going through the work. It was, and it was joyful for her, which was great. It was hard at first, because there was a lot of emotional work she had to unpack with her counselor, but it was also joyful for her.
Yeah, but you need to do that.
Mm-hmm.
You need to do that, especially whether it's a grief over losing a part of your body, or grief. It's almost like PTSD in a way. They're all
exactly. But see, I just that's why I talk a lot about, you got to create that co-narrative with your client. You cannot cover that story with your clinical narrative, because all I could have done was really wreck that more by saying, oh, well, that's why you're having pain, is because your brain's just trying to protect this, blah, 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 blah. Or, this is a form of trauma, and this is like, post-traumatic stress syndrome, and then you just can't do that.
No, the patient has to
can't do
rethink
that.
it themselves.
Yeah. You have to just kind of find out from them. She already said that she was, what was she deeply, that there was something else wrong that could be causing this pain.
Mm-hmm.
She didn't know what it was. She wasn't willing to talk about it. But remember, her deepest fear was there was something else wrong.
Right.
And, she said, do you remember when you asked me that question about what I really was worried about? And this was like weeks later. And I said, yes, I do. She goes, what I was really worried about was that the cancer was back. But I just didn't know how to tell anybody.
Wow.
So, and she, of course, that's why she was vigilant about going to the doctor. She didn't miss a PET scan. She didn't miss anything, because she was that, that fear was driving that.
Yeah. And you think about, she was so young, 29, right?
Mm-hmm.
I mean, at any age, but for someone that young to experience that, and everybody copes with it differently, but she literally, she literally, I don't want to say like neglect it, but it was just I'm done. I'm just like, it's like you see the body part and then it's all blacked out in the brain.
I think this is what they talk about when they talk about, the homunculus.
Yes.
And brain smudging and brain changes, when you have the things that are there, and even lateralization.
Yes. Yeah.
Being able to left-right discrimination, and those things that are so important with that. And by the way, once she was in counseling and once we were moving along and she really wanted to do more with her right side, I can tell you we had out the right-left discrimination app.
Yeah. Oh, yeah.
And did it with the shoulder and the neck. We absolutely did.
Totally. Yeah.
And, she was appalled at how terrible she was at it but she, she went through it pretty fast, and like I said, she wasn't catastrophizing. She wasn't depressed or anxious.
So,
she simply was just not, she was dealing with something that was so dark and demon on the underneath side. The only way that she could figure out how to cope with it was to completely not talk about it to anybody under any circumstances for any reasons except those people that she was seeing for the cancer remediation.
But it's so interesting because we've learned a lot about these questionnaires and people who you think are going to score really high on the CSI or anxious. Their scores reflect what you think, right? But when somebody's doesn't. Right. Or there's something else that you think you've screened for from a questionnaire, subjective, and something's missing. That you're surprised with all the years you've been practicing, right?
Mm-hmm.
That you're surprised and there's something else. Mm-hmm. And this is 2020 hindsight, obviously, but if I have patients now who are like, I know we're going to score significantly high. I could answer the questionnaire for them. That type of thing, right? Yeah, I know what it's going to be. Mm-hmm. But when you have somebody like that who you actually think could score, or you're surprised, like I have a patient, same thing. He scored low on the CSI, and I'm stunned. Mm-hmm. So there's something else driving it.
Right. Yep. And I think that's important is, again, you need to be careful not to color their narrative with yours. If you're going to listen to their narrative, you need to be quiet and listen to it. And then you need to kind of start figuring out where the common ground is that you guys can start, working together. And our common ground for her was those two things that we could attack immediately, which was the office where she didn't feel good, like her pain would increase, and reading.
Yeah. Yeah.
And those were a great common ground for us to start partnering on and start working on. But, when she was, it unpacked in the first session. That may not have unpacked until like session number 12.
Yeah.
You just got to be ready for it when it does. And it doesn't mean, and you don't have to fix it. You just need to sit in empathy with them and then ask them how they need to be supported and offer resources to them so that you can get them to the people that can really, really super help them, and continue on. And she wanted to continue her therapy journey while she was doing that. Which was great because it did allow her to learn a lot about her body, but to also, be able to exercise and do that fast walking and some of those things that she wanted to do without having pain.
Yeah. Yeah. Yeah.
And then she really enjoyed the new exercising that she was learning because she wasn't really doing like planks, push-ups, loading, any of that kind of stuff because she couldn't.
No. And exactly. Yeah, and she's using parts of her body and she's using and it's making brain changes at the same time, and
novel input.
That's exactly right. Yeah. It's fascinating. I love this story. I really did. Well, thank you, everybody. This was great, Susan. I really enjoyed this.
Well, there it is for our 75th.
75th.
Podcast.
Won't forget it.
All right.
All right, everybody.
Keep
Thank
the
you
testimonials
again.
coming.
Absolutely. Don't forget I'm sorry, go ahead.
Yeah, no, I was going to say opt into our newsletter. You get a lot of information out of that. We send that out every 2 weeks.
Yeah, toughtotreat.com.
As a new podcast comes out. We've got a YouTube platform. You can like and subscribe there, as my lovely 12-year-old niece will say. Don't forget to tell them to like and subscribe.
We've got some great videos on there. Our Facebook Lives are on there now.
Yeah, so you can actually see our faces on that one.
I know.
So we've got some good, whatever your jam is for listening and or watching or learning, we're happy to be here for a resource. And we're also on our Facebook page, Tough to Treat, so come and hang out with us there too.
Yep. Excellent. Thank you,
All right.
everybody.
Bye.
Enjoy.